Imagine being in pain 24/7. Aches, pains, muscle spasms, exhaustion, joint pain. Imagine dealing with brain fog, dyslexia, memory loss, blurred vision. Now imagine being misdiagnosed over and over and over again. Being told there is no way you could have a disease because you did not sustain the most common symptom. Because the disease you are suffering from cannot cause this much damage, or that there is no such thing. What about being told the symptoms you are having do not fit the guidelines of this disease? I have done research on this illness and seen all of these things happen to a person close to me. I hope to inform you all that living a life in pain, being misdiagnosed, and being caught in the middle of a controversial disease are the struggles that people suffering from chronic Lyme disease deal with on a daily basis. Now that I have introduced to you Lyme disease, some of you might ask, what is it? Lyme disease is caused by the Borrelia bacteria and is transmitted to humans through the bite of an infected black-legged or deer tick. It is most commonly diagnosed by the physical findings of a bullseye rash caused by the bite. The bacterium has a spiral shape which allows it to drill through the tissue and get to different parts of the body. Lyme disease is the most common vector disease and more prevalent than AIDS. Lyme disease is typically treated successfully within 2 weeks of treatment with antibiotic use. However, if the disease goes untreated, the infection can spread to the joints, heart, and nervous system. Keeping in mind if a person goes untreated, it can lead to chronic or late-stage Lyme disease and could potentially be fatal. The documentary Under Our Skin follows the lives of people living with chronic Lyme disease to show the world the tremendous amounts of pain that they are living through. Many patients in this documentary complained of joint pain, migraines, uncontrolled muscle spasms. Early stages of Lyme disease have symptoms such as fatigue, headaches, swollen lymph nodes, or a rash, commonly being the bullseye rash or the infected tick bite. As the disease continues to go untreated, more symptoms arise, including exhaustion, numbness in the limbs, or uncontrolled muscle spasms and seizures. Along with extreme pain, Lyme disease can cause neurological and cognitive problems such as memory loss, dyslexia. One person with the disease described it as feeling trapped inside your own body. In addition to the pain, many people are also misdiagnosed. Due to the fact that so many symptoms occur with chronic Lyme disease, 50% of patients may initially be misdiagnosed. Patients have been formally diagnosed with lupus, Crohn's disease, MS, fibromyalgia, arthritis, and Parkinson's disease. Others have been told that they may have a mental illness and to seek help. There have been many patients whom have gone to 5, 10, or 15 doctors over many years and been misdiagnosed. Misdiagnoses happen often because many doctors do not believe that Lyme disease could cause the symptoms patients are having, or because they simply did not have the bullseye rash. Despite many people being misdiagnosed, there were over 25,000 confirmed cases in 2013 alone. That brings us to the controversy of the disease. There have been many disagreements when it comes to the guidelines of Lyme disease. There is one group of doctors that say Lyme disease is hard to get and easy to treat. However, a new group of Lyme-literate doctors are arguing that the disease can be a persistent, chronic illness with different symptoms. Over the last 4 decades, there have been questions about whether or not chronic Lyme disease truly exists. According to Dr. Richard Horowitz, a Lyme-literate physician, it is possible that 20 years ago, people were just getting strictly Lyme disease. Now, however, the ticks have evolved and are carrying many different bacteriums in addition to Borrelia, such as Ehrlichiosis and Bovisa, a malaria-like organism. The bacteria can have many different effects on the signs and symptoms for Lyme disease. The Lyme disease spirochete can learn to live within the body without being found hiding from the immune system, as well as the antibiotics. The Infectious Disease Society of America and the Center for Disease Control guidelines state that Lyme disease is easy to treat, easy to cure, with only about 2 weeks of antibiotic treatment. This is true if a person is diagnosed early enough. The guidelines state that long-term Lyme disease does not exist, and if a person continues to have symptoms after treatment, they may have another illness. Joseph Berscano, a Lyme-literate doctor, indicated the guidelines completely ignored a worldwide body of literature that contradicts the quoted guideline. Samuel Donta, a former Lyme guideline specialist, affirmed that they never got to discuss chronic chronic or late-stage Lyme disease during the guideline review. Not having late or chronic Lyme disease in the guidelines makes it harder for patients to get treatment and also affects how insurance companies cover such treatments. As you can see, this illness is both political and economic as much as it is bacteria. As I come to a close, I would like to remind everyone of my friend who is still suffering from this disease and has been for the last 10 years. The disease has taken a toll on her body, her mind, and her well-being. She is in pain, she has been misdiagnosed, and continues to struggle with the controversy over this illness. I hope that I have informed you more about a disease you may not have known about, and I encourage you to keep this information in mind. You never know if one of your loved ones could be diagnosed with chronic